Okay, we're going to get started. So this is going to last for an hour. I'm very grateful for everybody who's attended this morning. Obviously, there's a huge amount going on in the DHB and in the nation at the moment. It's extraordinary times. But improvement actually probably has a huge role to play in the next few weeks as we have very rapidly reorganize the way we are working and the services that we're delivering. And I know that in my area, we've been flat out for the last 2 days just to reconfigure everything so we can deliver a more lean service and lots of people working at home, such as all of us today, hopefully. So I'm going to start off with a lecture on the topic of the basic methodology improvement. This is what the IHI have promoted as the model for improvement that everybody should be trying to use, not because it's the best, but because that means that everybody is using the same methodology. It makes it a lot easier. And I hope most of you, or at least some of you, will have done the online module, and this will be basically going through the same sort of concepts and building on it, but more importantly, allowing you to share your ideas and thoughts with other people in this webinar. So we're going to look at the model for improvement. We're going to find out how to set your aim, your measures, your change concepts, and then test those changes. So it starts off in this context. If anything needs to change and improve, first of all, you have to have a reason to do it. You need a will to do it. That means that not only do you need the reason, but you need to have a shared reason. You need to be able to communicate your reason with other people, and then you need to convince them that something needs to be done about it. That's called, well, some people call it burning a platform. So it's along the same idea that if you were standing on a train platform, waiting for the train to come, and that platform is burning, you would get off it and you would go to another platform. Well, it's the same thing with any change. People are not going to move to another place unless there's something really wrong with what is going on at the moment. So you need a will to improve, and building that will to improve is not covered in today's lecture, but it's really fundamental to be able to start change. And then the second thing is you need ideas on what to do. There are many tools for that, and that is actually built into the model for improvement. And then you need to execute it all, and that's where the model for improvement comes in. You need to make it real. So there are many different improvement methods around, as you probably know. There's the model for improvement, which the IHI promote, but there's also things like Lean, which came out of Toyota, and Six Sigma, which has come out of manufacturing. And they all have their pros and cons, you can't really say that one is better than the other, but the best thing to know is that you need to all be talking the same language. And if somebody comes along from the Lean Institute and starts using lots of Lean techniques and talking all this jargon, and everybody else in the healthcare is using the model for improvement, then you'll find that things don't work so well. So you either have to then teach people Lean, or you change to model for improvement. And there's lots of similarities between the models as well, and you don't need to stick rigidly to how they work, but having a framework, a roadmap, means that other people understand where you are along this journey, and then can engage with you a lot easier. So there are 3 questions and then the cycle. So what are we trying to accomplish? How do we know that change is an improvement? And what change can we make that will result in an improvement? And once we answer those questions, then we go on to a PDSA cycle, or Plan, Do, Study, Act cycle. Now, I always found those questions really confusing, actually, because they're quite a wordy way of asking much simpler questions. Basically, the first one is, what are we trying to do? The aim. What do you want to do? And how are you going to decide on that? Who's it going to be for? And how long are you going to wait until you want results? And what good is it going to do? These are all aims, things that you've got to put into your aim. And although the IHI don't actually state this here, actually I think that the best framework for stating your aim is using the SMART framework, which is an acronym for writing down an aim that is specific, it's measurable, it's achievable, it's realistic, and it's time bound, which means that you're going to do it by a certain deadline. So with an aim, you need to be bold. So there's no point asking for a small change. You might get it, but then what's the point? You need to ask for something that is bold. You need to be realistic, though. You can't ask for something too much. It needs to be clear. It needs to be something that everybody can, a vision that everybody can see as well, pretty much the same that's in your mind. The aim needs to be concise. If it's too long, people will stop reading it and they won't understand it. It needs to be measurable, as we mentioned, or else we won't know if a change has actually happened. And it needs to be meaningful. So this is about, again, tying it into the will, bringing people with you. So if you could use your chat functions and just quickly tell me which of these two aim statements is the better, the first or the second. So reduce all types of hospital-acquired infections as much as possible, as quickly as possible, or decrease the rate of hospital-acquired pneumonia for patients in the ICU from 23 infections per 1,000 catheter days to less than 5,000 infections per 1,000 catheter days by May the 1st. Right, so if you could just type your answers. Okay, thanks. Thanks, everybody. Thanks, Lisa. Thanks, Judy. Omar, Angela. Thanks, everybody there. And everybody else as well. I'm scrolling through. I can't say all your names that quickly, but you're all right. It's the second, absolutely. It's much more specific. It's a SMART objective, basically. So the second question is asking, well, what are we going to measure? And actually, this is a really, really important stage. If you can't measure it, it's really difficult to convince people whether your change has worked. And it's really good to try and think of measures that are objective, not subjective. Or at least you can measure them in a repeatable way, so that even if it's subjective, which can be things like patient satisfaction, you have an objective way of measuring it anyway. And there's three types of measures. There's outcome, there's process, and balancing. So outcome measures are what happens at the end. It's the goal that you're trying to achieve. And in healthcare, we think a lot about patient-centered measures. So from the patient's point of view, what would be important to them? So patients would want to be interested in, for example, how successful is their surgery going to be? If the surgery is a success or not, and we could measure that by saying, well, the hernia is gone, for example. That's a patient-centered measure. If we measured something along that process, so something that leads towards that outcome, then that is a process measure. So, for example, day surgery completed rather than doing it as an inpatient, which we know generates better outcomes. So that would be a process measure. It wouldn't be something that is necessarily that important to the patient. At the end of the day, what they want is a really good hernia operation, but they don't really mind too much whether it's done as a day case or as they have to stay overnight. For them, what's most important is the final outcome. And then balancing measures is things you want to measure that might actually go off as a result of your change. So A common one is patient satisfaction. You might change a process to make it faster and more efficient, but in the process of doing that, you actually lose the human touch, and that might actually show up in some sort of patient satisfaction scores or qualitative analysis, for example. So you can summarize this as where are we going, what are we doing, and what else is happening. So which measure is which? Here's another one. If you could use your chat functions. What type of measure is average number of times patients receive recommended oral care in 24 hours? What type of measure is patient and satisfaction scores? Well, I told you the answer in the last slide, actually. And what type of measure is rate of hospital-acquired pneumonia per 1,000 catheter days in the ICU? Oh, I'm sorry, Steve, if you can't use the chat. I'm not entirely sure how to help you at this time, but we will get the other people are answering, and I'll let you know what the results are in a minute. So Pragati is saying that the first one is process. Caroline saying it's process. Yep. Emma's saying process, outcome, outcome. I'll give you a clue. It's one of each type. So one of those is wrong. So so the answers here, most people getting process and outcome one. So the second one is, yes, Caroline, the second one is a balancing process. So for example, if you were to, one of my previous projects, I was trying to improve the access to straight to test colonoscopy for patients who had suspected colorectal cancer. And what was happening with these patients was that they were all being referred by the GP. They were then coming to the clinic and being seen by the specialist, who then decided, yep, you need a colonoscopy, and then off they went for a colonoscopy. And all that process, that appointment, took at least 2 weeks, 3 weeks to organize and happen, and therefore there was a lot of time that was wasted on the diagnostic pathway for people who had potentially colorectal cancer. So we wanted to increase the number of people who came straight to test, and we managed to do that, and so cut out that outpatient appointment and people coming straight for colonoscopy. But one of the possible potential downsides for doing that is then the patient doesn't get that connection with the clinician in a more sort of less scary environment before they actually meet them for the first time in the endoscopy suite, which can be quite a daunting place, especially as you've already probably been through bowel prep and you're not feeling the best, and you're taken out in your gown, you're stripped of your clothes basically, and you're in a unfamiliar environment, usually in an area where no support person is allowed to come. So that is something that we wanted to measure, the patient satisfaction as well on the change of this pathway, to make sure that anything like that and other areas that might crop up that we didn't think of were causing problems, then we could address those as well. So that's a balancing measure. So then the third thing in this model for change is that you need to then develop your ideas for change. And there are many, many great tools out there to help you do this as a group. There's a big long list of different types of changes that you can use. There's also more fun ways to do it. There's brainstorming, which is a tool that you can use, and there's some rules around brainstorming, such as no idea is a bad idea, quantity, not quality, and such things like that. brainstorming is a great, simple tool to help people generate as many ideas as possible and help them think wacky and laterally and outside the box. And then you can use another tool called 6 Thinking Hats, which is where you can align people's thinking. So people naturally think of different aspects of an idea in different ways. Some people may tend to think of the positives and are quite sort of optimistic or early adopters in terms of ideas. Some people are pessimists and they naturally think of things that could go wrong or not going to make it work. And other people sort of start to think, well, is this practical, or does this cost too much? Is it feasible? Is it something that we really do? These are all different ways of thinking about the same problem. And all of these things need to be addressed. But if you have people thinking in different ways at the same time in a group, you usually descend into a situation where people just simply don't agree on it. And what you'll find is that it's not that they don't agree on it, it's just that they want to be heard about their different aspect of opinion. So 6 Thinking Hats is a way of saying, okay, now we're going to talk about this idea and we're all going to talk about the positives. And then you take off that hat and you put another one on and you say, now it's time to talk about the negatives. And you'll find that that helps you appreciate different ideas much better than just a free-for-all discussion. So those are 2 simple tools that you can use to develop good ideas for change. So this is a list of change concepts that can help you. The actual list that you might have seen in the module is about 72 long, and I'm not so sure if that's helpful. I've not used it myself because it's such a long list. You're not going to get to the end of that. But it is useful to think of this shortened list, these categories of areas where there might be change, but know that certainly sometimes innovation comes from outside any of these lists. So what changes could improve oral care in the ICU? Well, there are different ways. You can improve workflow, you could optimize the inventory, you could change the work environment, you can manage variation, and you could design systems to prevent errors. So if you could maybe think of 1 or 2 ideas in those categories and pop them on the chat function just now. So Bragati, add it to the ops chart as a function of nursing. Great, yep. So that would be probably something around designing system to prevent errors. So that's a system where you try and prevent them forgetting about it, or it might be around improving workflow. So if it's part of their workflow, if they usually look at the ops chart, then that might be the where the reminder is. Lisa, is there available gear nearby? What do you need? Yeah, so that's right. So improving the workflow is about making sure that all the gear is nearby, that things are stocked, that maybe you have a pack rather than having to get individual things from different places. Angela, a checklist is a system designed to prevent errors. Yep, so yeah, you could have an end of the bed checklist, absolutely right. Providing education, yep, so that's a good idea. And that would be about changing the work environment. Okay, so here's all the answers that the IHI been talking about. So ensuring mouth cleaning supplies already, we said that. Ensure toothbrushes, mouthwash is consistently available. train hospital staff on proper mouth cleaning technique, update oral care policy to be consistent with guidelines for all patients, and post the oral care protocol in visible places. So these are all sort of examples on these, and you got a lot of them. That's great. So once you got your idea for change, you then need to start testing it. It's a bit like being a scientist and trying to experiment. And you do this with the Plan, Do, Study, Act cycle. Planning is where you decide how you're going to go about this experiment. Do is where you do it. Study is where you then look at all the data that's come about and you analyze the chart and you decide what's happened well, what's gone wrong, and then you act. So then you decide about making things different or implementing it if you think it's perfect. But the real beauty about PDSA is that you have to start really, really small. And this is about gaining momentum for change, because change is like an oil tanker. And if you're trying to push against an oil tanker to begin with, you don't get anywhere. But if you start off by getting your flotilla of tugboats together and you're testing them out to make sure that each tugboat is as strong as possible, and then you attach them all to the oil tanker, then you start to make a difference. And once you get it to move, then actually it becomes difficult to stop. So you must think of your change in the smallest possible cycle to begin with. If you're testing a checklist, for example, draw up the checklist and do it on one patient, and then ask people about it. And then draw your checklist up and do it for patients for a whole shift, and then do it for a whole week. And as you do these cycles, it gets bigger and bigger, and they get more difficult to do because, you know, sustaining something for a week is much more difficult than sustaining it for a day. But the people who are doing it for the week have already done it for a day, and they will be much more coming with you on this. They will be much more engaged and want to see it happen too. So because they're invested in it now. So Plan, Do, Study, Act is not just about the science behind, does this work, does this not work? Actually, what the power of it is actually bringing people along with you. It's about getting support for an idea. With one of the smallest PDSA cycles, you may only need to get the help of one other person to do it. But once you've both done that together, now you've got two people instead of one person who are sort of vying for this change. And then the two of you can then go on to do a bigger PDSA cycle and generate more support for the idea. So it really is about getting support, building an army behind you for change. So the model for improvement, the MFI, is basically these steps. It's setting an aim, establishing measures, identify changes, testing the changes, and then eventually, once you've done many PDSA cycles, you can actually implement the changes. Just before we go on to the next section, the model for improvement is great, but there is one disadvantage of the model for improvement that I have found in my practice, and that is that it doesn't at all along the way really make you think about sustainability. And sustainability is where in improvement we have found is much more and more and more important to get right at the beginning, because you can do this perfectly and implement the changes. But then if your whole team that you've built around you changes, as it does in healthcare, people move on, that organizational memory goes very quickly. And once you have the people different around, if that change is not really well embedded, which, you know, it takes a long, long time to do, you might find that then it starts to dilute or even go back to what it was before. And building in sustainability is something that is very, very difficult. But one of the key things is thinking about the people that need to be there from the beginning, who are going to be there for you in many years to come. And in an organization where there's lots of people changing around, that's very difficult to achieve sometimes. But sometimes you really need to think about who is going to be around for a while and who's going to make this last. And if that person is, say, an SMO in a department, who you know is permanently employed and going to be there for the next 20 years, you really need to bring them on board and make them a champion of this, and even get them to actually do some of the work, because then they are going to be invested themselves in it. And that's extremely difficult to convince somebody else who's maybe very busy, maybe has other ideas or their own things that they want to do, to bring them on board with your idea and get them to actually take it over and run with it. So now this section, we're just going to watch this quick video, and we're going to find out about PDSA cycles in collapses and also cucumbers. Now, if this video isn't coming out that well across Zoom for you, then you can try and type that URL into YouTube and watch it directly through YouTube.
I'm going to talk to you today about Plan, Do, Study, Act cycles, commonly known as PDSA cycles. So let's just go over for a second what those terms mean. And I'll start by telling you that this is a method we use in science, we use it in everyday life, and we certainly use it in improving healthcare. So plan, by plan we mean we're going to run an experiment. We have a hypothesis. We're making a prediction about what will happen when we run this experiment, and we're going to determine whether or not that prediction holds up. That's where the do comes in. We run the experiment and then we study, that's the S. We see whether or not our prediction was in fact verified when we acted on our plan. Based on what we find on the data we get from the PDS, we then revise our plan if necessary and act to change our plan and have another hypothesis and run another experiment. So that's pretty simple, and you're probably seen many examples of this in healthcare, even if nobody called it a PDSA. Let's look at an example of trying to prevent central venous catheter-associated bloodstream infections, or CLABSIs. Now, we all know that a checklist has been shown to be very effective in getting folks to reliably do the right evidence-based practices when they put in a line, and that reduces infection. The question is, how do you actually get that done in practice? How do you execute on that evidence-based plan? Well, we know that among the things you're supposed to do when you put in a central venous catheter are to prep the skin with a certain kind of antiseptic, it's chlorhexidine, and to use a large surgical drape. Those are two of the elements of the checklist. The question is, how do you get them to be at the bedside reliably so that the care team has them at their beck and call when they're ready to put in the catheter? So the physician's ready to put in the catheter, and you have a theory that if you include the surgical drape and the antiseptic in the packet of supplies that the team brings to the bedside, the physician will always be able to do it. He won't have to be looking all over. She won't have to be hunting for these supplies. And that's your theory, and you predict this will improve care. So you do that experiment, and lo and behold, not surprisingly probably, the drape is there, the antiseptic is there, the physician uses them when he puts in the catheter, and infection's probably less likely. That's a PDSA cycle in healthcare. So I know you're dying to try this in healthcare, and that's great, but I recommend that first you try it in your own personal life so you get comfortable with it, so that when you go to healthcare, you'll feel like, I've done this before, this isn't that hard. But I'm going to talk about, of all things, cucumbers. And I care about vegetables. I have raised beds. I spend a lot of time and effort. I don't want stuff to go wrong. So this year I decided I'm going to plant cucumbers, and prepared the soil, put in the fertilizer, dropped in the seeds, 3 seeds to a hill. They sprouted. I thinned them to 1. Things growing like crazy. And I run it along my bed and looking at it with admiration. I come back from work to home, and I see that it's been chopped off by a weed whacker. Turns out every Monday there's a guy that comes and he does our lawn, right? And he has a weed whacker, and he chopped off my cucumber. And this results in a pretty stunted cucumber. So I said, well, look, I have a theory that if I prop this cucumber vine up on the raised bed more carefully, the weed whacker won't get to it. That's my prediction. And so I put the cucumber vine up on the raised bed, came back. By golly, the head was chopped off again. My prediction was not correct. When I studied the result, it was a disaster for my poor cucumber, and so I had to revise my plan. I had to act in a different way. My next experiment was to put a large flower pot in front of the cucumber vine, hoping that the guy with the weed whacker would understand that he wasn't supposed to meddle with this thing. And lo and behold, I come back, another PDSA cycle failed, and he'd been mangling my cucumber again. At this point, I actually thought about something that you probably use in your life, and we certainly sometimes default to in healthcare, and that's called brute force. I went to find the guy, the weed whacker guy, and basically grab him by the shoulders and shake him and saying, "You're killing my cucumber." But I restrained myself. This is improvement. We don't want to have blame. We want to do things better and make things better for the weed whacker guy as well as myself. So my next PDSA cycle was to put the cucumber up on a trellis. I figured if I had a trellis, and I have a very pretty one, as you can see, it's in the shape of a leaf. It's really quite attractive. I propped the cucumber up on that so that a weed whacker really couldn't reach it. And lo and behold, look at it, it thrived. My prediction was get the thing out of the way so that the weed whacker absolutely can't get to it. This is called a forcing function. The forcing function is the darn weed whacker just won't get that high. He can't do it. And my cucumber's thriving, and I'm telling you, I had the best marinated cucumbers, a little onion, salt and vinegar last night, just like my mom used to make it. This was a really good PDSA cycle. So that's all there is to it. You can do that in your own life. You can do it in healthcare. Remember, you have to have a prediction. You have to start with a theory. Your job is to see whether or not your theory is a good theory. Most of our theories, we have some doubt, so go test it. Run a PDSA.
Great. So we found about how you can use PDSA cycles in your personal life as well as healthcare. And actually, that's quite a good sort of way to sort of get used to the tool. So in this example about CLABSIs, so that's catheter line associated bloodstream infections, what would be a reasonable next PDSA cycle? So if you remember from the video, they put in the drape and the antiseptic with the pack to make it easier for them to use. Can anybody think of another of the next PDSA cycle? So they did that for one pack. What do you think that they would do for the next cycle? You just put that on the chat. So these are saying audit if they're actually using, just because it's there, they might not be used. So that's absolutely right. That's the study bit of a PDSA cycle. So they put it in, but in the example, the study was that they watched them do it and it was done correctly. So that study has been done. But the next cycle, so Pragati, consider double gloving. So that would be a different PDSA cycle. That would be testing a different change. Angela, a sticker on the outside of the pack of what's needed to be added in order to complete the setup. So that'd be another different PDSA cycle. But the next PDSA cycle would be testing the same change in a bigger setting. So you've done it for one go. The next thing might be to put in lots of packs and see what happens over a day. And then you might notice that sometimes some people use the pack, but then sometimes some people get supplies from somewhere else that you never knew about. And so that PDSA cycle might not be as successful as the first one. And then you would think about ways to eliminate those secret stashes of catheter packs, for example. And then following on from that, the next PDSA cycle might be saying, okay, so let's do it across both our ICUs in our 2 hospitals in the DHB. Or I'm skipping ahead, maybe that's too much of a jump, but you can see how there's much more challenges involved with delivering it across 2 sites than there is delivering it for one particular line insertion. So that's what they mean by the next PDSA cycle. How can you think bigger for the same thing? All these other ideas, putting a sticker on the thing, gloves, those are all other things to do, and probably also useful things to do. And you can add them into your testing as you go along. But you must always think of your initial change and trying to make that bigger and bigger. Okay. So what PDSA cycles do you use in your daily work, even if it's not the name you use for them? So can you think of anything that, and we don't need to put the chat down, but can you just take a moment to think, what sort of things would you use, ways would you improve your daily work? So for me, sometimes it might be as simple as hand hygiene, for example. I might do a ward round and observe everybody on the ward round if they're doing hand hygiene or not. And by the end, if it's not been so good, then I might think of ways to improve the hand hygiene. And something we had recently, which is because hand hygiene is obviously extremely important, and at the moment, we said, well, we need a hand hygiene champion for each ward round. So we have somebody whose almost main priority job is to watch everybody else and to tell people, oh, you forgot to do your hand hygiene, or you touched that after you did your hand hygiene, you need to do it again, for example. And then go around and then see if that works. So that's an example in my area. What's the value of a failed PDSA cycle? Oh, this is obvious. You only learn from your failures, or you learn much more from your failures than you do from your successes. You know what doesn't work. Then you can hone things. You can stop people doing the things that make it fail. Think about the last PDSA cycle that you ran in your personal life. So we're thinking about outside of work. Even if you didn't know it was a PDSA cycle at the time, was it successful? Why or why not? So can you think of examples in your personal life? Again, we don't need to chat about this, but if you just take a moment to think about it in your personal life. So a common place that you might, in your personal life, want to use a PDSA cycle is starting up exercise, which is commonly quite a difficult thing. Usually people might do that around the time of New Year as a New Year's resolution. So your first PDSA cycle might be New Year's Day, where you go out for a jog. And then the next PDSA cycle might be for the next week. And that's where some people might start to see their PDSA cycles fail. So we're now going to go into an exercise, which is going to last for the next sort of 10 to 15 minutes, and then that will be the end of the webinar. I'd like you to open up a browser window. It can't be Safari because it doesn't seem to work, but basically going to open up a Word document. And this is the URL. You just need to type tiny.cc/lenvlz. And you will find that you get a document coming up. So I'll leave that URL up for a moment. Okay, so I'm now going to, I can see people typing already. That's fantastic. Right, so I'm just going to share that document on my screen, but don't get confused with the document that's on your screen. Okay. Okay, so here we are. In this document, we are all going to type our ideas, and then we're going to review each other's ideas. So what I'd like you to do, first of all, is think about an area in your personal life that you want to improve. And you could make it up, or you could do it over several weeks. I'm just noticed somebody's deleted all of it. Let's see if we can get that back. Okay, let's see if I can get it back. Just a moment. Maybe if the person who deleted all the stuff up, could you undo what you just did? Because I can't seem to get it back that quickly. Anyway, we'll carry on. So what I'd like you to do is type your initials, and some people are starting, that's great. So type your initials and then answer the 3 questions in order. Now, the first question, I'll type back there, is basically, what is the aim? The second question is, what are your measures? And then the third question is what are the changes? So basically, it's the PDSA 3 questions. I want you to answer those about what you would do in your personal life. Make the aim SMART: specific, measurable, achievable, realistic, and time-bound. And if you could try and type below the highlighted area, that would be great, so that we can keep the questions visible for everybody. I'll just put the URL up again for people who are still struggling. So to those of you who are struggling to access the document, it's a Word online document. If you can't access it, I'm very sorry. There may be, you may find if you're using Safari, it doesn't work. So you would need to use something like Chrome or Explorer. But if you can't see it, doesn't matter. If you can't use it, doesn't matter. You can watch what other people are typing, and then we're going to go through it in about 3 more minutes time. Okay, so apologies to people who are having technical issues. I'm loving some of the improvement ideas that people are putting up. That's really fun to see. And it's great to see everybody working on the document at the same time. It just shows how we can still collaborate, even though we're all in different places. Just another minute to finish off what you're typing. Don't worry if it's not finished. And don't worry if it's not perfect. This is simply just an exercise, and the next section is probably what's more important. The next exercise we do is probably more important. Okay, so if you could all just stop typing, that would be wonderful, because it just makes it a bit easier for us to all look together. So you've done that, and the next thing I want you to do is to review somebody else's project. So I want you to read some of these projects and use the comment function, which is up on this tab here. You click on review, and then you can add a comment using this button here. So click on somebody's initials so you add the comment in the correct place, and then click that, and then add a comment. And the things that you can comment about are written down here. So does it seem possible for the project to be completed within several weeks, or whenever their deadline was? How clear and complete is the aim statement? Is there a complete family of measures? Are the measures clearly related to the project goals? Are the initial change ideas clear and well defined? So these are just some prompts for you to review. And please be constructive in your criticism, and supportive and encouraging. So if you could work on your comments, because it'd be really good if everybody at least left one comment, because then it's likely that everybody will have a review of their idea, which is the whole part of this exercise, is to understand the value of peer feedback when it comes to improvement ideas. Okay, so for the last couple of minutes, I'm just going to pick out a couple of ideas. I saw that JM wrote here to undertake an exercise program to reduce weight and improve fitness levels 1, so that in 4 weeks I've lost 2 kilos of weight. This will be measured using pedometer, active and resting heart rates, analysis of active kilojoules burned per day, personal evaluation of improved fitness, reduced shortness of breath, changes and results measurable weight loss on scales. So that's a pretty good example there. The aim is specific to an exercise program. It is measurable, so measuring the weight loss on the scales, as well as things like heart rate and stuff. So the weight loss would probably be the outcome measure. Things like the heart rate and kilojoules burned, those would be process measures. And if you were to put in balancing measures, then maybe you might also put in your, time for other things during the day, because I know somebody who might start to exercise 8 hours a day might find that other areas of their life suffer. For example, that might be a balancing measure. So specific is smart. It's a smart aim. And then talking about the measures, well, the measures there are quite objective and measurable. And then the changes, well, the changes is to undertake an exercise program. And maybe to flesh out that idea more, you would need to say exactly what the exercise program entails, how does it fit in with normal life, to understand whether it's realistic and achievable. So that was a good example there. And then we'll just pick out another one, for example. Let's see. AD says to have a clear distinction between work and home while in lockdown. So that's really important, absolutely. Have times allocated in routine for being at work versus at home. We'll track overruns of timeframes to encourage improvement in routine. Figure out how constant attention from my dog fits in all of this. Well, that's interesting because my dog has also just pushed his way into this room right now. He's sitting on the sofa. So, yep, that's good. So is it specific? Yeah, we're talking about a clear distinction between work and home. Is it measurable? Well, yeah, you would have to measure it though. You would have to maybe have a timesheet of when you're doing which and home versus work stuff. Is it achievable? Probably, but it is quite difficult. Is it measurable? Yes, if we measure from timesheet point of view, but you could also measure, I don't know, quality of life, your satisfaction, your overall well-being or sense of well-being. Is it time-bound? Well, maybe, yes, it is, while in lockdown, although that's a moving target at the moment. And it might be that you actually want to tighten up that time-bound because you don't want to only achieve it by the end of lockdown. You want to achieve it relatively early on in the beginning of lockdown so that then the rest of the time you're in lockdown, you're benefiting from your changes, I guess. So then the measures there would be maybe the timesheets as we discussed, etc. And what changes? Well, maybe we've not managed to get that far to describe what the sorts of changes you would do to your routine to try and get that improvement. Anyway, so I don't have time to go through everybody's examples, but you do have access to this document, and later on I'll circulate the document so you can have a good read of everybody's idea and everybody's comments. And if you do have time and you want to continue polishing it up, then that's fine. I won't publish this until, later on today. So if you want another 10 minutes after the end of this webinar to have a go at it still, that's absolutely fine. So just pulling things back for the last minute. Sorry. So how did you select your aim, your measures and changes in your thing? What is your level of confidence you will be able to make this change? And how do you think having a written plan will help you? And what did you learn during this activity? Well, these are things that you can ponder, but you'll probably find that by writing it down, by really thinking of it in this way, you increase your confidence. The written plan helps you be accountable for it. I hope you really enjoyed this webinar. Thank you so much for taking some time out to do this. I hope you find it maybe a bit of a respite from COVID-19, and I'm sure you all are doing an amazing job helping in your areas, being prepared for probably the biggest healthcare challenge that we've ever faced. Very, very thank you very much, and goodbye.